Regardless of what year it is, fall will in general bring a huge number of hacking and sniffling. Yet, in 2020, we don't simply need to keep thinking about whether we're engaging a cold versus occasional hypersensitivities. The smallest hack could raise fears of COVID-19. So in case you're feeling sick, how would you truly know whether it is a cool, this season's virus, occasional sensitivities, or a sign that you've gotten the novel COVID? Well-being authorities are asking any individual who has COVID-19 side effects or who is concerned they've been presented to the infection to get tried. While numerous occasional diseases have comparative manifestations to COVID-19, there are some key contrasts. Coronavirus. The tail COVID is a respiratory ailment, so indications center around the lungs. For some patients, a dry hack and fever are the most dominating manifestations. Different side effects incorporate weakness, trouble breathing, another loss of taste or smell, a throbbing painfulness in the body and a sensitive throat. A few patients experience regurgitating or the runs, however those are more uncommon. As per the World Health Organization, on the off chance that you experience extreme chest torment, a critical windedness or lost discourse and development, these are not kidding indications that need quick clinical consideration. Influenza. Flu is additionally a respiratory ailment, so it conveys huge numbers of similar manifestations of COVID-19. In the event that you think you are catching this season's virus, since a portion of the indications are so like COVID-19, testing might be expected to help affirm a conclusion, the U.S. Communities for Disease Control and Prevention (CDC) says on its site. A few Canadian well-being authorities additionally recommend getting a COVID-19 test. A few side effects do contrast. Cerebral pains are more connected with influenza, while another loss of taste or smell is something that would point towards COVID-19. The questions that people ask in conjunction with the advent of the winter season about the distinction between conventional influenza and the coronavirus, and these questions come as a result of fears that controlled people as a result of the similarity between symptoms between them, and the truth is that many viruses show similar symptoms to corona and the traditional, seasonal influenza when infected due to the wide circle and range of similar viruses, the most prominent of which is SARS. Therefore, corona disease was initially called similar SARS or Saudi SARS. The truth of a new coronavirus outbreak in China. The coronavirus belongs to the coronavirus family, and it takes a crown-like character when viewed using a microscope, and its diameter reaches 150 nanometer, and the chance of its reproduction is considered faster than any other virus, and Arab countries recorded proportions in the number of infections with this disease, and Saudi Arabia was at the top of the pyramid in the number of people infected with it, then followed by the United Arab Emirates and the Hashemite Kingdom of Jordan. Among the types of coronavirus is what is known as the corona that causes Middle East Respiratory Syndrome, or the Middle East coronavirus, or corona novel, and its abbreviation is denoted by MERS-CoV, which is an abbreviation of the English words Middle East Respiratory Syndrome, and it was discovered in the Saudi capital, Jeddah, in the 24th of September of 2012, and the attempt to isolate the virus had been successful from the corpse of a deceased man after he had symptoms similar to influenza, but that had developed over time: kidney failure. Its reproduction begins the life journey of the coronavirus in the human body when the genetic material of the coronavirus reaches the cytoplasm of the infected cell and begins to reproduce, and it sends the DNA, and this virus differs from the influenza virus and measles that the coronavirus does not reproduce itself, and as we mentioned earlier, the coronavirus is the virus the fastest spreading of other viruses due to the lack of a copying process. And concerning the issue of the emergence of the coronavirus from the influenza virus, it is a completely false fact because each of them belongs to a different viral family, but there is a similarity in the symptoms of infection with them only. The incubation period for the coronavirus lasts for up to 12 days, and it is possible that the virus can maintain its life and spread under certain conditions that allow it to multiply, such as dry surfaces and in a liquid environment, for a maximum of 6 days. SARS virus, it is the virus that was discovered in the Chinese capital, Hong Kong, and killed thousands of Chinese, and recorded hundreds of deaths. *The new coronavirus 2019. Symptoms of the coronavirus. A person infected with the coronavirus in the Middle East have flu-like symptoms at the beginning, but the matter develops within a short period, and these symptoms are symptoms similar to the symptoms of influenza, and include sneezing, sinus obstruction, mucus secretions, cold. High body temperature. The patient's temperature rises to a temperature of 39. Cough. The patient, the virus carrier, develops a dry and severe cough. Inflammation of the upper breathing canal, throat, fever. Acute pneumonia. In advanced cases of infection with the coronavirus, it may lead to the development of complications, among them is kidney failure. Methods of infection. The corona is transmitted from one person to another in several ways, the most important of which are inhaling the patient's respiratory droplets, use of patient tools, pillow, cap. Infection of health workers with it, infection from patients. Touching contaminated surfaces. Diagnosing the coronavirus. The competent health authorities to detect the coronavirus take measures to detect the presence of the virus, and we mention the following: isolation. The person suspected of being infected with the coronavirus is isolated until it is confirmed or denied. Electron microscope. Serological tests. PCR technique. Prevention and treatment. So far, medicine has not reached a specific or radical treatment for the coronavirus. Rather, supportive medicines are used to alleviate the symptoms associated with it, such as lowering the body temperature, and using supportive means for breathing, in addition to a primary preventive vaccine, and it is known that a dirham of prevention is better than a pound treatment, so taking caution is more important and more worthy of treatment methods, and among the preventive methods are the following: avoid sneezing and spraying the patient. Avoid contact with contaminated surfaces. Avoid contact with eyes, nose, and mouth. Take care not to use the injured tools. Always wash your hands with soap and water. Use protective masks in crowded and public places. Isolate the injured person and stay away from contact with him. Influenza viruses A and B invade the upper part of the respiratory system, causing it to become infected, and it is indicated that influenza infection abounds in the winter season, so this flu is classified into seasonal. It spreads quickly among people and invades all age groups without exception. More difference in symptoms include the symptoms of COVID-19. Our understanding of COVID-19 is progressing quickly, and health professionals around the world have come up with a symptom picture that you might expect to see in adults. The most common symptoms are those of a fever, dry cough and fatigue, with symptoms such as a loss in sense of taste, smell, headache and breathing issues also occurring frequently. In children, it has recently come to light that there is potential for bowel symptoms such as diarrhea to also occur. That's all for today's video. Thank you for watching. Please like, share and subscribe to the channel, Health and Beauty, for more marvelous videos.